It is suitable for general family viewing.
Karibuni sana. My name is Dr. Wainaina Wanyoike, general practitioner at Komarok Modern Utawala. And today we're just going to talk briefly or go much into details of what is pregnancy, how do someone know they are pregnant, what are the steps that you need to carry out, and so on and so forth. So I hope this session is going to be as interactive as possible, and we're going to help many people with more information as we can. So on to the definition, as we all do. What is pregnancy? Pregnancy is basically a medical condition that starts from the time of fertilization to the time of giving birth. Yeah, and in this journey, there are many things that may happen to someone. We know with pregnancy there are some physiological changes that will happen to a woman when they become pregnant. The body will start changing in terms of the amount of blood that they have. We usually say that an adult has about 5 to 7 liters, but for a pregnant lady, that amount of blood almost doubles. Yeah, it's all in preparation to delivery, because the body has been prepared in a way that we would expect one who is going to bleed during delivery. So, what are the things that someone might see or might notice, and they will be questioning if they are pregnant or not? One of the changes that will happen, obviously, they will find that they have missed their period. That will be one of the indicators. Two, you'll find that someone will start experiencing tenderness on the breast. Others might present with morning sickness. The morning sickness, in this chance, we are talking of nausea, vomiting. They try to eat something little, but they are not holding it on well. Other might have cravings for non-food stuffs, like example yenye watu wanajua zaidi, unapata mtu anakula mawe. That's also another indicator. Other indicators that you might notice is the weakness, generalized body weakness. Someone just feel fatigued, even if they have just worked on for a short duration. And also the other things will be, they will be increasing in body weight, which is called an increase in the metabolic rate. And these are just some of the symptoms that someone might present with. There are those who can even present with spotting or vaginal bleeding. And this one is usually an indicator of the time of implantation, mostly. And the best thing, if someone has this symptom, is to just go for a medical checkup so that you can know exactly where you are at. Yeah. So if you go for a test and you test yourself at home, these days there are those home tests that you can, the kits that you can use even at home, easy to use, totally reliable. The moment that someone knows that they are pregnant, it's now a time to start on the journey in the preparation for the motherhood. One, you need to go to the nearest facility that offers the prenatal care. In this sense, you will be subjected to a number of tests. The test can be to rule out some infection, to check on the level of your blood, what we call hemoglobin count, and also majorly the infection that they are checking in this chance is the infection that can be transferred to the baby. Basically HIV, syphilis, majorly for those sexual transmitted diseases, those are the major ones, and also for hepatitis B, given that it can be transferred from the mother to the baby. Some other instances, we can ask for the spouse to join also for the testing, so that we can know exactly if the spouse also has some infection, that it can be able to pass to the lady and then consequently to the baby. So we need to have the testing done well in the preparation for that. The other thing that is usually done when someone just presents to the hospital for the test, for the follow-up, it's usually an ultrasound. It's called an obstetric ultrasound. Basically, the word obstetrics means the duration of that time of prenatal or a medical practice that basically manages people who are gravid. Gravid, we mean pregnant. Yeah. And the ultrasound basically the first ultrasound basically wants to do some few things, which are majorly to know where the pregnancy is at, so that you can know what type of a pregnancy it is. To rule out if there are multiple pregnancies. By multiple, I mean if there are twins, triplets, or quadruplets, or whatever they are called. And also to know the position of the placenta implantation. Has the placenta implanted itself at the base or near the cervix, or is it at the fallopian tubes, or where exactly is it at? Yeah. And basically the ultrasound will help you in planning for the subsequent follow-up for this pregnancy, because there are many types of pregnancy. Yeah, you can have a pregnancy that is implanted on the fallopian tube, which is basically called an ectopic pregnancy. Basically, that's the major word, or that's basically the major thing that someone will notice when you are talking of an ectopic pregnancy. They will think of the fallopian tube. But ectopic just means a pregnancy that is not within the uterine cavity. Yeah, you can have a pregnancy that is in the abdomen. Instead of it being implanted on the fallopian tube or the uterus itself, it goes to the abdomen. And sometimes that pregnancy can even be carried up to term for someone who has not done the scan to know exactly where it is until the last minute, where you discover that the cervix is not opening and the baby is not there, only for someone to end up doing a cesarean section. The other one, the types of pregnancy that you can encounter, is the single pregnancy, where it basically means there is only one fetus in the uterus. Twin pregnancy basically means there are two fetus. And the other pregnancy that we might talk in these terms is the high-risk pregnancy. By high-risk pregnancy, we mean this is a pregnancy that someone has either hypertension before they even got pregnant, they are diabetic, or they have some changes that can occur after 20 weeks of pregnancy, where the pressures will start to go up, or they get to notice that they are diabetic. Or in this chance, we are talking of gestational diabetes or gestational hypertension, and the hypertension can go to complicated forms, which they call eclampsia and preeclampsia. Yeah, in which basically means someone will have high blood pressure that cannot be controlled, and they can have convulsions subsequently due to this pregnancy. So as I said in starting form, is that a pregnancy can change a woman's body. So it's not only affecting the size of the uterus, like it's going to increase as the baby grows, but also it can affect the morphological and the physiological changes in the body. Yeah. So if you look at the things that can be done in the prenatal care, which the prenatal basically means that time before someone gives birth, and the period will last from the time that a woman notices that they are pregnant to the time that they will give birth. And basically the screening that can be done here is to check for this complication that can be noted in pregnancy, of which from the ultrasound, and also checking the blood pressure, checking the sugar levels, which the hormone progesterone will affect an increase in the sugar. It's more of an antidote, if I may use that one, to basically how the sugars are being monitored, also accompanied by the beta HCG levels, which are basically the hormone that is sustaining the placenta for it to be attached. It will work against the insulin hormone, and the sugars will start to rise. Basically, someone will be checking for these vital signs, if I might call them that way. When you're presented to the triage, you are checked your pressure, your weight, your sugars, how it is, and you are directed onto the right channel. If well and good, everything is within normal, nothing to worry about, you just proceed with the pregnancy. And in this instance, someone is usually placed on supplements. Basically, the supplements are folic acid, the iron supplements, and the calcium supplements. Why calcium supplements? Because the baby is using the mother's calcium. By this chance, there is demyelination or demineralization of the bones and the teeth, which they are the ones that will be giving out the calcium. And you want to replenish the calcium that the mother is losing to the baby. So we kind of give the calcium supplements on that. The other things can be checked during the prenatal period. It's when you do an ultrasound. Basically, this ultrasound is done by between 20 weeks to 24 weeks. This ultrasound can tell you if the baby has any anomalies or not. By anomalies, we are saying if there are any malformation on the baby. And there are those malformations that are compatible with life, and there are those that are not compatible with life. And this is where someone can even be advised for a medical termination of the pregnancy if the pregnancy is having risk to the mother, or there are malformations that are not compatible with life. Yeah, and that's now the importance of doing the ultrasound. I know before or a long time ago, ultrasounds were not that popular. Or even these days, people might even question, why do you do many prenatal ultrasound? Do they have any effect to the baby? Even if you do 1,001 in a day, ultrasound will not do any harm to the baby. This basically due to the modality itself. It uses the composition of just light and sound to just trace on the images that you can be able to interpret. So there are no radiations at all that are given to the baby, and that's usually one of the areas that people are worried about. So nothing much to worry about there. Before we take a short break, I know there are people at home who have no idea of how to test for pregnancy. It's just basically a very, very simple procedure. All you need is urine, which we are assuming right now we have our urine here, and just this pregnancy strip. There are many strips that can be there in the market. It doesn't have to be just this brand. And basically, the test itself, you just dip it in the urine, and it will show you exactly if you are pregnant or not. So when you take the strip out of the paper, it will just have these two sides. You have the upper part and the down part. The down part is the one that is just plain white. The top part, it has two sides. You have the side which you will be holding, and the part that goes into the urine is the side with the arrows. These arrows, they are indicating the maximum level that you can immerse that strip into the urine, and you don't have to immerse the whole strip up to this level. It has to be up to where the arrows are pointing. Yeah, and basically with that, you just hold on to your urine container, hoping that you have placed it into something else, and you dip the strip. Doesn't have to be for long. The moment you see the water level rising, or the urine level rising, like for this one, you can see it has started to rise from there. You just leave it and you place it on a flat ground like that. You doesn't have to wait for the whole period. Yeah, it has like a sponge that is on the edge. This sponge will contain the urine and it will keep on seeping through until it has completed to run over the course of the window that is open there. Basically, a test for you to confirm if the positive test is a true positive or if it's a negative test, for sure, you have to give it time around 5 to 10 minutes, basically, for you to know if the test is a positive one or is a negative one. Like for our test at the moment is indicating a negative, though you have to give it time. Yeah, you don't have to wait for long. If it's a positive test, it will show 2 strips. Basically, it's like any other strip test, just like a HIV test, how it is. It will just show 1 strip for a negative and a positive for 2 tests. The mark that is usually indicated at the end, this is called the controller, and the one that will appear at the front, that's now the test that is basically positive for that individual. Yeah, and you give it time. 2 strips appearing there, 2 lines, 2 red lines. That means it's positive. 1 line, negative. Yeah, basically it's as simple as that. Yeah.
Is there any point where it will be confused? Like
what do you mean by confused?
If there are times that are clear.
No. It has to be clear. The only time that it can be a bit faint, it's when the pregnancy, maybe it's in the early stages, and basically it measures on the hormone that is released by the placenta. That's why it's only positive in pregnancy. Yeah, and the hormone that is usually released by the placenta is the human chorionic gonadotrophin hormone, or HCG. Yeah, and this one is only happening in pregnancy. If it's of little amount, yes, it can be a bit faint, but it will go back to a bit thicker color after you give it that time that is around the 5 minutes to 10 minutes. If you give it that time, even if for starters it was a bit faint, by the end of that it will be totally clear. Sometimes you can have a test that it will first indicate as if it's positive, but as time goes on, that line will disappear. Yes, so you have to give it time, not to jump into conclusion the moment that you dip it and you feel positive. You have to give it time. Yeah. This is just the urine test. You have what we call a confirmatory test, which is done on the serum. Serum is just basically blood that is put on a centrifuge, and you get the plasma part. That plasma is used to check on now if someone is truly positive or they are negative. You can also have what is called a beta HCG titers, which is basically to quantify on the amount of the beta HCG that is being released here. And basically this one is done for the type of pregnancy that is called a molar pregnancy. Molar pregnancy just basically means, yes, someone is pregnant, but it's just the placenta tissues that are there. There is no fetal heart rate, there are no limbs that are forming, but yes, they are pregnant. And basically for this case, someone is usually advised for a procedure called dilatation and curettage, just to remove on those placental tissues. If it doesn't go away, they can be put on some medication to reduce that. Yes, and it's more of an abnormal pregnancy. We just take a quick short break and we'll be right back.
You are watching TV 47, the home of untold stories.
Upgrade your DSTV package to enjoy all the content you love. That means if you're on Access and you
Yeah, like you see, these are the fabrics we use for the sofas. Yeah, there are different types of fabrics.
Sabak.
It is the
best way to go. Eat color, eat raw, you know, like this is alive.
Well, 2022 is behind us. 2023 is here with us. What are your plans? We here at TV47's Morning Cafe have great plans for you. We're talking about information, we're talking about entertainment, we're talking about the greatness for the year. So make sure that you're always with us every morning.
Kwa muonekano wao hauwezi ukajua waliopitia. Kwa sura zao zinapong'aa hauwezi ukafahamu changamoto zao. Nyuma yao ipo stori la historia. Katika kipindi Mfahamu Kiongozi tunakupa nafasi kuweza kuwafahamu kila siku ya Alhamisi kuanzia saa 1:30 kuendelea. Nami Elizabeth Mutuku.
Usiyakubalie maumivu ya misuli kukatiza ratiba yako. Kaluma Pain Balm ni dawa ya kusugua iliyotengenezwa kutoka kwa miche maalum ili kutuliza maumivu ya misuli. Kaluma Pain Balm. Maumivu yakizidi, pata ushauri wa daktari.
Imagine starting your academic journey here at the foot of Mount Kenya, a place where you can call home, a place where we celebrate our diversity and uniqueness, a place where you can be at your best, at work and at play. That place is Embu College. There's no better place to make the difference than Embu College. Karibu Embu College, where a holistic education matters.
You are watching TV47, the home of untold stories.
Okay, now welcome back. As we embark on this journey of pregnancy, we'd like to just know how long does normal pregnancy take. Yeah, you find someone being told that you are now past your due date. So what is normal? Normal pregnancy basically means this person is carrying the pregnancy for only 40 weeks. We as medics, we like to use weeks instead of months. I know in the training we are in school, we were being told 9 months, but basically it has been noted that the pregnancy takes about 40 weeks for it to mature, and that's what we'll be saying this is a normal pregnancy. Also, don't get it wrong, when someone delivers at 37 weeks, by 37 weeks the baby is usually mature enough to survive outside the uterus, and basically the 3 weeks that are usually there, they are just for adding weight, and everything is normal. And also don't get scared when someone goes up to 42 weeks. Yes, you are given a maximum of 2 weeks post the 40 weeks, so that you can ensure everything is happening on well without trying to rush on the pregnancy. It's usually the baby that initiates labor. Basically, when the lungs are mature, the baby will send a signal which will start on the contractions. So basically mtoto hajafika wakati yake kutoka. So what happens now after delivery? Delivery basically it's defined as the natal period or the antenatal period. That's the natal period or the perinatal period. That's basically the time of delivery, and after delivery we call it postnatal. The postnatal period is basically 6 weeks as from the time of delivery. That duration from the time of delivery up to 6 weeks. This period is when now the body physiology starts going back to normal. One thing that might be noted mostly is women post-delivery, they will start having lower limb swelling, unapata miguu zimefura, that is basically normal. As long as the pressures are within the normal range, you don't need to be worried about that. The other thing that might happen is that during this period, one might find themselves having some cardiac issues, or what we call postpartum cardiomyopathy. Remember, the amount of blood within this person was almost 2 times above the normal, and it will cause some changes into the heart muscles. Sometimes you find that the heart muscles have enlarged. That's what we now call the cardiomyopathy, basically the enlargement of those muscles. And sometimes they go back to normal. Some might require medication, some only for a short duration, and other might require medication for a longer duration. And this period is also important to check on the bleeding. Basically, after delivery, we expect where the placenta was attached is basically a wound, yeah? And this wound is a big one, and we expect it to be bleeding a bit. We are supposed to be monitoring this bleeding, how it's going on, and it's called lochia, and it keeps on changing the color. It will start from bright red. As time goes on, the color will be almost yellowish, and then it will be a bit clear. Up to the 6th week, that's when now we know that this person has undergone the period which is called puerperium, or basically the postpartum period. Yeah, and this period also, that's when you'll be explaining to the mother, if they are the first time mother, how to do the attachment, how to care for the baby, how the vaccination is going to happen for the young one, anything that they might have an issue with in caring for the young one. There are basically things that can be normal, but for a new mother who this is their first time, they will be almost abnormal to them because they don't know what they are dealing with. And this time, some might even have stress, or what we call postpartum psychosis, or when someone would just feel like things are not working well. And there are those who might require counseling, there are those who might require even medication. And for pregnancy, basically is a stressful event, and most of the mothers are encouraged to have support, mostly from their partners, relatives. Find someone who you can be able to talk to when you are feeling a bit stressed. Yes, depression is real, even on a higher extent, it's even more real in pregnant ladies. And it all starts with speaking up. There are those who might require counseling. There are those who might just, when they vent something out, they will be okay. But it's basically a step that one needs a lot of support. And given that when someone is bringing this new life into this world, they need an environment that is more welcoming, well-nurtured, and they don't have to be stressed about it. Yeah. So we encourage people to speak out, have that support, and so that you can be able to have a good and safe delivery, and also post-delivery that things will work out well. What are the things that someone can do when they are pregnant? What can they not do? What do they eat? What don't they eat? Basically, we encourage someone to take balanced diet, and for those who are having vomiting episodes, which we call the hyperemesis gravidarum, or basically means hypervomiting during pregnancy, we encourage them to take small food but of more intervals. Take something small but use frequent intervals, not to have the normal schedule that we are more accustomed to, the one that you take your breakfast, lunch and supper. You can have some snacks into between so that you can ensure that you are faring on well. Remember, you are eating for 2 people or 3 if you have twins, and basically you need to be more energetic, more getting the nutrients well. You can do some walking, light walking, heavy chores. You don't have to do a lot of work. Remember, if you do more heavy work, you might predispose yourself to miscarriage, basically loss of the pregnancy. And you need to be a bit active also, so that you can have a safe delivery. We have found that, or research have found that, for people who are more active, they tend to have a good delivery or a more simpler delivery as compared to those people who are just living a sedentary lifestyle. And also the sedentary lifestyle can also expose someone to the hypertension or the diabetes issues that can also be noted in the pregnancy also. These incidences also of the hypertension and the diabetes, they need to be followed up well so that someone can know where exactly are they at. Because remember, with diabetes and hypertension, they are not only affecting the mother but also affecting on the child, and they need to be taken care of well. And that's also why we encourage even people to take on the supplements so that they can be able to balance on the diet if that they are not acquiring well. We'll just take a short break. We'll be right back as we continue to digest this information in regards to pregnancy.
You are watching TV 47, the home of untold stories.
Tonight, tributes continue streaming in honor of the fallen former Education CS George Magoha.
Did his work with total commitment, and that's how one is identified as a serious person. You have lost a great man, and that is how it happens.
Burial plans underway as he is set to be buried after his late brother. Also tonight, survivors of the Kikopey deadly crash recount moments before the accident that claimed 7 people, including minors.
Siku ya leo asubuhi kitu 4:30 tulipatana na ajali ya barabara kielekea nyama choma pale Kikopey.
Plus, KRA justifies a plan to spy mobile money transactions amid other radical proposals as it strives to raise trillions for President Ruto's first budget.
Individuals who have been making money, earning income, and which has been escaping our dragnet. So we will also be focusing very much on the individuals and businesses, pay bills and the tills and every other transaction in the digital space that we ought to collect taxes from.
Upgrade your DSTV package to enjoy all the content.
Yeah, like you see, these are the fabrics we use for the sofas. Yeah, there are different types of fabrics.
Sabak. This is the best way to go. It color, it roll, like this is a line.
Well, 2022 is behind us. 2023 is here with us. What are your plans? We here at TV47's Morning Cafe have great plans for you. We're talking about information, we're talking about entertainment, we're talking about the greatness for the year. So make sure that you're always with us every morning.
To go into much details on when someone has now completed this journey of pregnancy, the 40 weeks are over, what next? We will expect this person to be delivering, but what determines the mode of delivery and what are the modes of delivery that are there? So if we go into steps, basically there are 2 modes of delivery. We have what we call the normal delivery, basically means an SVD delivery or spontaneous vaginal delivery, and we have a CS. For a spontaneous vaginal delivery or an SVD, this basically means the mother will come in labor, they go onto the labor for monitoring and delivery, and they proceed well without any complication being noted. Remember, when someone presents with labor in our hospital, they are admitted into the maternity. This is one of the most stressful situations with women, because they know there is no other way for checking the progress of the baby than doing the V, and people are not comfortable with that, but it's just basically the only way that can be noted if the cervix is opening or if it's not opening. The normal cervix opens up to about 10 centimeter, and by the time that it's reaching the 10 centimeter, we also expect the baby, the presenting part of the baby, to be descending also. If you find the instances that the cervix, yes, is not opening, or the baby presenting part, which in most cases is usually the head, it's not descending, it can now predispose someone to go for an emergency CS. Yeah, when we are talking of CS or cesarean section, it can be an elective procedure or an emergency procedure. An elective procedure means before someone even got into labor, due to one reason or the other, they already knew that the mode of delivery was going to be a cesarean section. In this instance, for example, what we can be dealing with this in this case is for someone who has already had a previous cesarean section. We don't encourage them to do normal delivery based on the reason that took them to the first CS in the first place, or someone with multiple pregnancy. With multiple pregnancy, we are talking of someone with twins, triplets, and or even 5 children there. The other incidents that can predispose someone to an elective procedure, it's the presentation of the baby. Remember, I said for normal delivery, the head is usually what will be presenting part. But if you find an instance that the baby has not turned and the legs are the ones that are presenting, or the arm which is presenting, this is called a breech presentation. That also can predispose someone to go for an elective procedure. And the other thing can also predispose person to go for an elective CS is basically the position of the placenta. If the placenta is at the cervix, and remember we are saying the cervix has to open, it means that the baby, even if the cervix is open, because of the position of the placenta, this baby will not pass. That's also an indication for an elective procedure. That will already be known before someone goes for the CS. Yeah? For the emergency, it's usually done due to a number of reasons. One, if you have what is called a non-reassuring fetal state. Basically, this means during the monitoring, when you are checking on the baby's vital organs, basically the heart, it will either be above 180 or it will be below 120. The normal heart rate for the baby should be between 120 to 170, there in between. But if you have instances that the heart rate is either too high or too low, that can be also a reason for an emergency cesarean section. Basically means the baby has started to get into distress. And there are scenarios that can also cause that one, basically what's called a meconium stained liquor. Basically the water that breaks if it's stained, and usually it's stained by basically the baby when they are passing stool. The first stool is called meconium, and this one is usually greenish in color. If you do the rupture of the membranes, when the water breaks, it becomes when it comes out, it's noted to be stained, and usually there are some grades that are usually assigned to that. A grade 2 or a grade 3 is usually an indication for a cesarean section, an emergency one. The other thing might predispose someone to going for an emergency CS is the prolonged labor. During labor, one is usually monitored. There are some tools that have been put in place from the WHO and the FIGO societies. They have noted that by use of this tool, which is called a patograph, it can be able to assign someone if they have prolonged labor, or if it's obstructed labor, and that will also be an indication for an emergency CS. And when someone is now going for the normal labor, there are options that are there these days. you can have the delivery done by a gynecologist, or you can have the delivery done by a midwife. And the advantage of having a gynecologist is that when there are decisions to be made, they will be made up front. And if it's a cesarean section that is an emergency one that is going to be indicated, you don't have to wait for someone to come and say, let's now go for a CS. You have a gynecologist being there all through. There are also advantages that this gynecology that will be delivering you has been following you all through the pregnancy period and knows exactly what are your drugs that you are reacting to, what are the conditions that you are suffering from. And usually it's more of an advantage instead of going to meet the midwife who you are meeting for the first time. This is not to mean that midwives don't do good delivery. Yes, they do. And basically they are trained for that, and they can be able to handle any emergencies and be able to escalate where the need be. It doesn't deter you from seeking their services in one way or the other. Yeah. Now, one area that people have always asked is, if you have gone past the 40 weeks and there is no indication for a CS delivery, what usually happens? Yeah, when someone presents to the hospital past the due date and they have no contraindication for a normal delivery, what is usually done, it's called an induction of labor. It basically means if there is a medication that someone will be given to start on the labor, instead of waiting for the baby to give us the signal for the labor to happen. And if the baby is quite well mature, an induction of labor can be done. And when the induction of labor is done, one is usually monitored throughout the labor process. And everything, when the labor peaks, when someone goes into the active labor, that's more than 4 centimeters. When the cervix has opened more than 4 centimeters, we expect everything to run smoothly, just like the normal labor for someone who has just presented with the contractions and everything. In this case, everything is just basically the same. There are no differences between the two. And only just that we induce this labor instead of waiting for the baby to give us the signal. One thing that I might touch a bit is that there are situations that someone can present with labor only to be told that you are in forced labor. What is the difference between true labor and forced labor? Now, for true labor, you got to have contractions that are increasing in frequency and intensity, and these contractions, they have to be accompanied by a change in the cervical changes, whether it's the dilatation of the cervix or the consistency of the cervix. And mostly they are usually accompanied by what is called passage of the mucus plug. Someone can just, before the water breaks, if they are at home, a week before the labor starts, they can have a bit of a vaginal discharge, which is usually mucoid. That's what usually, and it might have a bit of blood in it, and usually that's what it's called a mucus plug or show. Yeah, but for a forced labor, they will have contractions, but these contractions are not increasing in any way. There is no change in the intensity or the frequency, and the contractions, they are just constant. Yeah, there are no changes in the cervical dilatation or the consistency. And mostly these forced labors, they are attributed to usually STI or not STIs, UTIs mostly. And why UTI in this case? Due to the fact that the pregnancy is lowering the body immunity, a woman is more exposed to getting UTIs, and they can predispose them to get this forced labor. And when this UTI is not well taken care of, it can cause someone to progress into active labor even before the the 40 weeks are over. And that's the time that someone will present with what is called a preterm labor. And when that happens, you have to deliver a baby who is a preterm, meaning before term. And this baby, they usually end up in nursery, where they are either having complication with the breathing and they are more susceptible to getting infections. So basically the time from the time of implantation to the time of delivery, this is a very crucial time for someone to be well taken care of, to be monitored, to be given the supplements that are necessary to carry the pregnancy up to term, to have a test to basically rule out if they have any infection, and to also be given medication and the right medication, not to seek for over-the-counter medication, so that they can be well taken care of during this period and to avoid complications that may arise after. So as we wind up, let me just say pregnancy is a state that when one gets themselves into, they should be well prepared in mind, body and spirit. Why do I say that? Basically, this is the most trying part. The woman is usually stressed because they are getting symptoms that they don't even understand sometimes, and they need to be in a well-nurtured environment. We encourage the male gender to support their spouses during this period, and also to enable someone to go into safe practice of the delivery. You need to start the prenatal screening and the prenatal management as soon as possible. As soon as you know that you are pregnant, you start on the folic acid, the iron supplements, the calcium supplements, and these will go in a long way with preventing complications that can happen to the baby and also to the woman. Also, get to know if your pressures are within the normal range. Don't get stressed when you go to the hospital and everything that you are going there, even a single time they will be just checking your pressures on how they are. Don't get annoyed with that. It's just basically to check if the pregnancy has done any changes into your body and to avoid you into going into complications, which we talked of, the preeclampsia or the eclampsia. And when you go to the hospital, kindly, if you ask about any previous medication or any previous medical history, kindly don't hide that. We are not asking this information so that you can spread it to anyone, but we are asking because of your own benefit. You might have a medication that you are reactive to, but if you don't tell us about that and you end up going for an emergency procedure and there is no one to ask, it might be fatal. So always during pregnancy, get good diet, do a bit of exercise, not heavy chores, and we pray for everything to be successful. And it's the joy of everyone to get a pregnancy that is up to term and also to have a healthy child. So it's been a pleasure being with you, and we welcome you to Komarok Modern, where we have all these range of investigation and care that is happening every time of the day. It doesn't matter if it's at night or if you just wake up in the middle of the night, you'll meet someone who can be able to assist you in that. So karibuni sana.